COVID-19 update.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, January the 18th. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday and Wednesday, we'll be providing written updates at approximately 3 o'clock on COVID case counts and other relevant information with respect to the COVID-19 pandemic in British Columbia. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So today being Monday, we'll report on 3 reporting periods. From January 15th to 16th, we had 584 new cases diagnosed with COVID-19 in British Columbia. From the 16th through the 17th, an additional 445 new cases. And in the last 24 hours, an additional 301 people were diagnosed with COVID-19. That brings us to 1,330 new cases, 4 of whom were epidemiologically linked cases. So our total in British Columbia is 61,447 people who've been diagnosed with COVID-19. Of the new cases, 281 were people in the Vancouver Coastal Health Region, 548 were in the Fraser Health diagnosed with COVID-19 in British Columbia. From the 16th through the 17th, 45 new cases, and in the last 24 hours, an additional 301 people were diagnosed with COVID-19. That brings us to 1,330 new cases, 4 of whom were epidemiologically linked cases. So our total in British Columbia is 61,447 people who've been diagnosed with COVID-19. Of the new cases, 281 were people in the Vancouver Coastal Health Region, 548 were in the Fraser Health Region, 65 people were in the Vancouver Island Health Region, 257 people in the Interior Health Region, 166 people in the Northern Health Region, and 13 cases were people who normally reside outside of Canada, and the majority of those 13 cases were some of our new temporary farm workers who've come into BC for the coming season. And as you know, we are continuing our program of providing quarantine accommodations in hotels and support for people, the temporary farm workers who are coming into BC to work on farms in the very important role that they play supporting our agriculture industry here in the province. So we now have 4,326 active cases across British Columbia, of whom 343 are in hospital, 68 of whom are in critical care or ICU. Additionally, we have 6,865 people under active public health monitoring. Again, that continues to exclude the monitoring they're doing in the north. And 54,656 people have recovered in that they're no longer positive for COVID-19. Over the last 3 days, we've had an additional 31 people in British Columbia who've died from COVID-19, bringing the total number to 1,078 people who've died. The vast majority of those are seniors and elders in long-term care. And to the families, the care providers, and our communities who've lost our seniors and our loved ones, our thoughts and condolences are with you again today. We have one new healthcare outbreak to report over the last reporting period at the Eagle Ridge Manor, and outbreaks are now over at Aged Care Harmony Court, Laurel Place, Capilano Care Centre, and McKinney Place in Interior Health. And we are very thankful that McKinney Place has been under control. That was a very challenging outbreak in Interior Health, and we know 17 people in the McKinney Place community lost their lives to COVID in that outbreak. That leaves us with 48 active outbreaks in long-term care and assisted living and 10 acute care units, involving 2,054 people in long-term care, 1,339 residents, and 708 staff. So we do want to bring you up to date today on some of the immunization activities that have been going on for the last few days. And I don't know if we have a slide available yet, but I will provide the data, and we will have both a slide available, but also it will be posted on the BC CDC dashboard as of this afternoon. So since the start of our immunization program in December, we have provided 87,346 people with COVID-19 vaccine in BC. And over the past week, we've received 46,675 doses of vaccine, 28,275 of the Pfizer vaccine, and 18,400 doses of Moderna. The Moderna vaccine, I will note, though, that 18,400 doses all came on Friday, and a good proportion of it was distributed around the province, and over the weekend, doses were delivered. So this week, we are expecting another 26,775 doses of Pfizer vaccine, in total, including 24,375 doses of the Pfizer vaccine and 2,400, the final installment of the doses we were meant to receive last week of Moderna vaccine. So where that leaves us right now is of the 87,346 doses that we have given, 71,301 have been of the Pfizer vaccine out of the 78,975 doses we've received, and we've provided 16,045 doses of Moderna of the 38,900 doses we received, just recognizing that the 18,000 and some of those doses of Moderna just arrived on the weekend. And since Friday, we've delivered 9,695 doses, 6,679 of the Pfizer vaccine, and 3,016 doses of Moderna vaccine. So as you can see, the program continues. Our focus continues to be on immunizing all people who are at the greatest risk, and that includes residents and staff who work in long-term care homes around the province, as well as the key roles that we have in our acute care facilities. As you know, as it was announced last week, Canada has received notice that there will be delays in the Pfizer vaccine supply for this week, but more specifically for next week and the subsequent 2 weeks. Although the supply comes back up again very quickly, next week is where we'll be most affected. We received those numbers over the weekend, and We know that this delay will temporarily slow our delivery into the next phase of at-risk people, particularly into other parts of our hospital system. However, the process we knew was going to be changing and changing frequently, and we know that these challenges with such a large program that's going to be going on for many weeks. We have, however, been able to rearrange and look at the process that we have to make sure that we are continuing with providing the first of 2 doses to those at highest risk, and that we are able to start second doses at day 35 in accordance to our plans that we announced a few weeks ago. So that is our focus over the next couple of weeks. It is a bit of a setback, but it is only a delay. We are expecting to receive and have been reassured that we will receive the extra doses at the end of February and early March to be able to continue to expand our first dose program and to ensure that those at highest risk in our high-risk categories are covered as soon as possible. What that will mean, though, is that the focus will be on second doses starting next week and the week after, and then we'll building back up again to be able to provide additional first doses to those at risk. And as I mentioned, the dashboard will be published this afternoon on the BC CDC website. And we do have to remember that even though our COVID-19 immunization program is underway and continues and will continue in the coming weeks and months, the risks remain high all over British Columbia, and we see that from the numbers over the weekend. This is why we need to continue to take those measures that we know work to stop the spread. It's to keep everybody who has not yet been vaccinated as safe as possible in this period of time of hope and challenge as we move towards being able to provide immunization to everybody. It's also why we continue to have our public health orders and restrictions in place. I do want to pause, though, because the science has shown us, and it shows us now in what we are seeing across the world as people are being immunized, that these vaccines are very effective. And from somebody who's been working in the vaccine world for 30 years, it is amazing to us that we can have in such a short period of time a new technology that is 95% effective in protecting somebody from a new disease, and even more effective at preventing people from having severe illness and dying from COVID-19. This is amazing to all of us, and it's what we need to focus on to keep us going through this period of time until more vaccine comes and we can protect more of our community. Right now, it's our individual efforts that will have the biggest impact, and we can't yet rely on vaccine to protect all of us. In the next few months, though, we will have more and more people protected. And although today we have a slight delay, we are still on track to protect those most vulnerable by the end of March, and starting in April to expand dramatically the access to vaccine to people across the province to protect us all. For now, stopping transmission in our communities keeps our long-term care homes safe. Stopping transmission in our communities keeps our schools and our workplaces going and safe. The biggest risk and the biggest variance we have right now is all of us, our human behavior, the choices that we make every day. So no matter what variant of the virus is circulating in our communities, we know we need to stop the spread in the same way that we have been doing for the last 11 months. We have the tools, and it is in our control. That means keeping our safe distance when we're with others, particularly in indoor public places. No social gatherings, even small gatherings we have seen, can spread this virus to the people we are closest to, and that is what we want to avoid at this period of time. Wearing masks when we're in indoor public places, covering our cough, cleaning our hands regularly, and staying home if we're not feeling well. and of course, getting tested if we have any concerns at all. Let's show each other that we remain committed to doing our part to protect our seniors and elders who've not yet had the vaccine, even as we have more of this protective vaccine in our communities. But we need to protect our neighbors, our families, our loved ones, and do this to support all of our essential workers who are there for us every day. Across our province, today and tomorrow and for the next few weeks, everything we do will make a difference. And as always, we do this in the spirit of kindness and staying calm and being supportive of each other and staying safe. Thank you.
Thank you very much, Dr. Henry. I wanted to start by expressing my condolences. Our thoughts go out to the families, the friends, and the caregivers of the 31 people who passed away from COVID-19 over the last 3 days in British Columbia, 14 in Fraser Health, 4 in Interior Health, 2 lived on Vancouver Island, 4 in Northern Health, and 7 in Vancouver Coastal Health. 17 from Friday to Saturday, 9 from Saturday to Sunday, 5 from Sunday to Monday. It is an extraordinary and difficult time for people to lose loved ones for any reason, but particularly from COVID-19. Our thoughts go out to everybody concerned, and in particular in this time. And again, it always makes one reflect on the costs of the pandemic, which are enormous individually and collectively, and how we have to continue to do everything we can every day to support one another. Today, as Dr. Henry's reported, we have 343 people test positive cases of COVID-19 in hospital, 68 in critical care. These numbers have stayed relatively stable for a month. They're slightly below, but they're essentially at the same level for the last month. I would say what this means for our bed capacity, and we report on this on a regular basis, is that 86.5% of base beds in our healthcare system are currently occupied, meaning that there are 1,263 vacant beds available in the entire healthcare system. When you add in our surge beds, that number is 75.3% occupancy and 3,811 available base beds. Equally in critical care, the occupancy rate, the second number should be 68.2% of overall hospital occupancy at the moment when you include the surge beds. We have a 75% occupancy level of critical care beds, which is 129 amongst our base critical care beds that are available or are vacant at the moment. And when you add surge critical care beds, our occupancy rate is 51.3%. When we look at the 86.5% of base bed occupied in general, at this time of year, that number is closer to 100%. So we do have and continue to have some flexibility in our healthcare system, but as I try and reiterate every time I speak of this, the challenge and the pressure and the effort in our healthcare system has never been higher, as reflected not only in the work of people supporting people with COVID-19, but in the fact that we are also providing significantly more, for example, surgeries and other healthcare procedures than have ever happened before in this month of the year. So this is a significant time, and I want to pay respect to everybody in the healthcare system. On the question of vaccines, as Dr. Henry said, 87,346 people have been vaccinated against COVID-19 with either the Pfizer or the Moderna vaccine. What is, I think, a significant achievement for all of our teams involved in immunization. There will be on the dashboard today information about that. The information provided by Dr. Henry will be available on a dashboard, and it will be updated every day for people to see. On Wednesday, we will be adding information by all health authorities and by first and second dose. As many of you will remember well, it was 35 days ago tomorrow that people received their first doses of the Pfizer vaccine. Therefore, the 35-day period begins as of tomorrow for a small number of people. In the first week, you remember, there was only 4 trays of the Pfizer vaccine, or 3,900 doses in that week. So there'll be a limited number of second doses this week, and then that number will grow in the coming weeks. And we are continuing, as you know, and in spite of the fact that we have seen some reduction in what we had been told that we would receive with respect to the Pfizer vaccine, and that number will build back up in March. And in fact, we'll see all of those vaccines only later, and that this is a setback, meaning that a higher percentage of the vaccines we'll be delivering in the next month will be second doses by definition. But nonetheless, I think as demonstrated in Dr. Henry's op-ed article on our reasons for having a 35-day interval. We're going to continue on with that as a consistent policy of a minimum of 35-day intervals and proceed with second doses across the system. I want to thank everyone for their work in this area. I do want to also note that all 4 of the care homes where outbreaks were declared over today were significant outbreaks: at Harmony Court, in Fraser Health, at Capilano Care, in Vancouver Coastal Health, at Laurel Place, in Fraser Health, and at McKinney Place in the Interior Health Authority. And I can tell you from my own experience, but the experience I'm sure of every family member and every resident in long-term care, that the day an outbreak is declared is a very, very difficult day indeed. And the day it is declared over is a day of some relief. Not that the pandemic is over, but that this moment in the pandemic has changed. And I'm thinking of everybody who's lost someone at those care homes, everyone who's been through that experience, even if they were not diagnosed positive with COVID-19, everyone who works in those care homes. We're thinking of them today on what is, I would say, a better day in all of those places, the day that those outbreaks have been declared over. I just want to briefly provide a PPE update from last week. As you'll know, up to January 11th from March, the following PPEs arrived in BC: 8,200,095 or equivalent respirators, almost 143,500,000 surgical or procedure masks, 3.1 million pieces of eye protection, including goggles and face shields, almost 330 million pairs of gloves, and almost 19 million gowns. Over the past week, the following PPE has arrived in BC: 994,500 surgical or procedure masks, 105,596 pieces of eye protection, 3,387,000 pairs of gloves, and 419,016 gowns. And as always, we will continue to pursue any available leads in terms of procuring PPE and building up our supplies of PPE. And as always, all of our, especially when coming from new sources, all of the equipment, all of the PPE we receive, I should say, will be properly tested before used by any healthcare worker in BC. Wanted to note that as of January 18, 2021, we know that at least 1,420,027 doses of influenza vaccine have been administered to British Columbians. We also know that the number of doses is higher than that. There's a reporting lag of up to 30 days from pharmacists and physicians and other community providers such as nurse practitioners. And it continues to be the case that there is no evidence of community circulation of influenza. However, influenza testing continues at elevated levels. So far, no long-term care facility influenza outbreaks have been reported in 2020-21. Conversely, 19 long-term care facility outbreaks were reported during the same period in 2019-20, and that, I would suggest, is really, really good news under the circumstances. And so I just want to say finally that it was about a year ago this week that Dr. Henry and I did our first joint statement with respect to the COVID-19 pandemic. It was January 21st, I think, a year ago, and it has been a long year. And I'll leave it to others to recount specific developments. But for my part, I will say that as I watched our fight begin in BC, I saw, and we have seen, and we've seen through the course of the pandemic, a lot of worry, a lot of fear, a lot of loss, a lot of uncertainty. And while COVID-19 gives each of us every reason to experience those feelings each and every day, I also saw from that day something else, something reassuring: resolve, spirit, strength, compassion. And while fear and uncertainty, I think, are part of every day in a pandemic, what has kept us going is seeing how British Columbians in every part of our province, each and every day, refuse to let fear and uncertainty rule. What I saw a year ago, what I've seen since, and what I continue to see is the triumph of action over adversity, the power of commitment over fear, and the strength of common effort in battling an invisible but determined foe. Staying 100% committed to such a fight is no easy thing. Staying 100% all in on such an effort for so long is no easier. But that's our BC way, and I would hope that everyone sees what we're able to do when we continue to draw upon the very best in each of us to push back that which relentlessly seeks to take so much from all of us. This is a key time, a time we all need to dig in. So 1 year later, what I'd like to say to everybody, for all that you've done, to healthcare workers and essential workers, and to people all across BC, thank you. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle du 15 et 16 janvier, celle du 16 et 17 janvier, et celle du 17 jusqu'au 18 janvier en mi-journée. Il y a eu 31 nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 1078 personnes décédées du COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pour la première période de référence, nous avons eu 584 nouveaux cas. Pour la deuxième période de référence, nous avons eu 445 nouveaux cas. Au cours des dernières 24 heures, 301 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19, 343 personnes sont actuellement hospitalisées, dont 68 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up only. I would also ask that you please take your phones off mute. You are not audible until your name is called. First question today is from David Molko, CTV.
Dr. Henry, David Molko at CTV here. I'm just looking at the data from last Friday's COVID situation report. It appears we've had 5 young people under age 20 hospitalized in critical care. That's in the last month, including 2 of them under age 10. Wondering what you can tell us about their conditions, underlying health conditions, the possibility of MIS-C, and I wondered what concerns these serious cases present to you.
Yeah, so we have seen an increase, and we've seen that over the last few weeks, particularly since school ended in mid-December. In cases in young people, we've been watching it very carefully, trying to determine exactly what the contributing factors are. Most of it is related to transmission within households and within small groups. So that is a challenge. I can say that all of the children who were in ICU have now recovered or are no longer in ICU, as far as I understand it. As well, we have had 5 cases now of MISC, and I usually present those updates on a periodic basis, so I'll have the data for that later this week. The most recent cases were young people as well who were in ICU. Both of them have recovered and are now home. We've had, of the 5 cases of young people with MISC, all of them have recovered completely so far.
Follow-up, David?
And that is good news. Dr. Henry, back on November 30th, I asked you what was surprising to you about our pandemic at the time. And at the time, you said something about how early we started to see our second wave here. I also asked you about what you needed more of that you didn't have at the time. And you said that was more experienced contact tracers. So it's been 6 weeks. We have a new year. I want to ask again, what's surprising to you, if anything, about where we are right now? And beyond more vaccine, what do you urgently need more of right now that would make a good difference?
Oh, yeah. Very good questions that I don't know that I have the right answers to. Clearly the things that we are doing in our community is working, and when we pay attention to those things, it makes a difference. And we see that in Fraser Health in particular, where testing rates are still high, where we now have seen rates come down. There's areas of focus that we are still seeing large outbreaks. some workplaces, and these are essential workplaces. So we've put some concerted effort into trying to have a stronger presence in many of the workplaces with our environmental health officers working with WorkSafe BC to increase inspections, to increase our understanding of how the virus is transmitted in workplaces, because we can't close down all of the grocery stores and distribution centers and food processing plants, etc. So we've been putting quite a lot of focus on that. That is an area where wish I had more resources to be able to support workplaces in being safe. I think the biggest thing, of course, is in long-term care, and that's why our focus has been on protecting people in long-term care through immunization, and we are at a tipping point. I am hopeful and positive about where we've got enough, where we have vaccine to protect residents and staff, and that I'm hopeful that the outbreaks that we're starting to see now that have slowed down, but we're stopping that second generation. So it's rates in our community that reflect in our schools, that reflect in our long-term care homes and in our workplaces. So what we need to do is bring those down. The challenges we face now, which are different and have moved from November, are that we're seeing more widespread in more communities transmission in the interior and the north. And it is a challenge again about making sure that we keep our gatherings small. It's the same things that are leading to transmission events that we saw in the Lower Mainland a few months ago. So we know what we need to do, and now it's come home in a lot more communities. And so we need to take a step back and go back to our basics, stop the spread.
Next question is from Justine Hunter, Global Mail.
Hi, thank you. The federal government has sent British Columbia about 1.3 million of these rapid test kits, and I'm just wondering, what are we doing with them?
Yeah, lots of things. I think there was a report that came out from the testing committee, that their task group that they set up nationally, and I know Dr. Mel Krasdem from BC CDC is part of that, and we've been looking at where can we use these. I will also point out that we started to receive them in late October into November. They needed to be validated, but where we have found them to be useful is in some more remote communities where the machines themselves can be used, and if somebody is sick and there's a longer turnaround time to get the gold standard, the nasal pharyngeal swab, to a lab, that we can use those to determine if it is COVID that is causing the illness. And so I've talked about this in a number of times in how do we use it to detect outbreaks, and it is really a single test by itself is not very accurate with these rapid tests. So it is if you have a cluster of people and they have respiratory illness and you test 5 or 6 people and they're all negative, then you can be relatively reassured that it's not COVID. And if any one of them is positive, it tells you that that's likely to be COVID in everybody. So it's an approach that we use with influenza, for example, as well. But what you need to do is have the gold standard as a backup. So we're using it in a number of First Nations communities and more rural, more remote communities where turnaround time is a challenge. We're using some of the rapid tests as well in the downtown east side, where people may not come back to get their result a day or 2 days later, and we need to have the result as best we can then, right then and there. There's been some challenges in using it in those situations, in that they don't perform as well, even in the relative non-cold that we have in British Columbia. We've been using them as a pilot in some places to supplement testing in outbreaks and in long-term care, but they're very resource intensive, and that's what we're learning. The report shows us around the country. We're trying to find where these fit in as a tool, as one of the tools that we can use, and when they best can be used The other place that we're using them quite successfully is in admissions or remands to our correctional facilities, because then again, it's important to have an understanding rapidly whether that person coming in has this, and we can also back it up with a nasopharyngeal swab. So those are some of the areas that we're using them. It's it's been a challenge.
Follow up, Justine?
Yes, thank you. Actually, a question for a colleague. Alberta's announced today that they have finished vaccinating residents and staff in long-term care, and I was hoping we could get an update on just how far along we are in BC.
Yeah, so we are farther along in some places than others. The Lower Mainland had the amount of vaccine earlier on, and we're well on our way to completing all long-term care homes. It's in the 80% or higher for both Fraser Health and Vancouver Coastal for residents and homes in the Lower Mainland. It took longer and more challenging with in the North Interior and Island Health, where care homes are more spread out in different communities, and the vaccine has been coming in smaller amounts. But the target is to complete all care homes by the end of this week, next week, depending on when vaccine arrives this week.
Next question is from Vaughn Palmer, Vancouver Sun.
Good day, Dr. Henry and Minister Dix. Report out of Ottawa indicates the federal government estimate of the significance of the shortfall from Pfizer means that over about the space of the 4 weeks, Canada will receive 650,000 fewer doses than expected. Based on BC's share, does that suggest the BC shortfall over those 4 weeks will be, in the 75,000 dose range?
So the numbers we've got, it's in the 60,000 dose range in the shortfall, particularly next week. And this week it was only a small amount. Next week it's quite a large amount. The week after it's a lesser amount. But we are expecting and have been told that that amount will be made up in March. So that means that in this coming 2 weeks, in particular, we're going to have a higher proportion of the vaccine that we have on hand going to second doses and fewer first doses than we had initially planned with the amounts that we were expecting to receive. Having said that, it's not a matter of months, it's a matter of weeks. So we are moving ahead with those priority populations, and when they might have received vaccine next week and the week after, it will be the last week of February, first week of March that we'll be planning for. So we are, we knew that these types of things could happen, so we're trying to have some flexibility in the provincial program to be able to focus on where we need vaccine to target the populations as soon as possible. The other side of it is that we'll be doing more first doses in March versus February, which means we'll actually do more first doses than originally planned in the first 3 months between December and the end of March. Because the second doses for many of the people that will be pushed into later in March when we expect to have a much higher supply. So it's a challenge, but it's one of those logistical things that we spent quite a lot of time over this past weekend working through how we could make it work and stay true to our commitment to getting those second doses into people as soon as logistically possible as well.
Vaughn, do you have a follow-up?
Yeah, is the 60,000 that you're not getting that you expected, there was some indication from Minister Dix on Friday that was maybe half of what was expected, but I realize the numbers may vary from week to week. But as a ballpark estimate, is that 60,000 doses about half what was expected through that period?
It's about half of what was expected in that period. Yes, that's correct. Though we have been told that will be back-end loaded, so in March. at the latest.
And half of the Pfizer, but the Moderna is still...
Yeah. Oh, yes, that's true. This only affects the Pfizer, so we are continuing to receive the doses of Moderna that we have been that has been committed over that same period of time.
Rob Brown, Dawson Creek Mirror.
Good afternoon. We've had over the weekend an elected official here note that he was traveling in Mexico and is now in quarantine. And I've been in touch with some Minister of CFS officials as well, and they're saying that the PHO orders are just bylaws. And you know, when it comes to be it elected officials at any level now, and then obviously other ministries, how does the Premier and obviously you know, the Health Minister and then the Officer of Health reconcile other ministers or other ministries that aren't seeming to take the efficacy of these public health orders seriously, and then in addition to elected officials that seem to want to travel when at the same time the Premier is announcing or looking into banning travel from the province? What does it take for the Health Minister and the Officer of Health to say that at least we'll get other elected officials and then other ministries to toe the line, so to speak, as far as enforcing and abiding by public health orders?
Yeah, so public health orders are legal orders. The challenge is, or the difference is, there is no public health order requiring people not to travel. It is a strong recommendation from us, particularly not to travel internationally, and there is a public health order that requires anybody who travels outside of the country to self-isolate, to quarantine for 14 days on their return. That is law, and it is also a federal quarantine order. So there's both in terms of the requirements to quarantine if you return from outside the country. We have strongly recommended that people not travel except for essential reasons, even within BC and certainly interprovincially as well right now. We are in this critical time in this pandemic where we have hope and we have light, we have vaccine, but we also have a lot of COVID right now, not only in BC, but also across the country. I don't know if you want to talk about that.
Well, I think, first of all, if people have concerns about elected officials in whatever jurisdiction, it's not, it will be ultimately up to the people of Dawson Creek to decide about the overall performance, including all that they do of elected officials in Dawson Creek, just as it would be in all the other communities where these issues have been raised. So what I can say is pretty simple. No to non-essential travel right now. This is a critical moment in the pandemic, and this is a decision we all have to focus on in our lives. What's essential and what's non-essential, I think for most people, is pretty clear. And so my message to everybody is not to do that right now. And that means to people in other jurisdictions coming to British Columbia, our advice, our strong guidance is don't travel for non-essential reasons. And to British Columbians who might travel elsewhere, whether it's internationally or to other parts of Canada, the same. Don't do it right now. This is a crucial moment. We're starting the immunization campaign, but we see around the world, and you don't have to look very far to see places where stable situations with respect to COVID-19 have become highly volatile and unstable in a very short period of time. And that's why, if you ask, the one thing that we need right now is for people to dig in, to follow public health guidance, to continue to follow that right now. It's critically important, especially in this period between now and the period in the early summer, perhaps, when a significant number of people will have been immunized, and then September, when we hope that everyone will have the opportunity to be immunized, to really dig in right now. It's critically important that we do so right now to stop the disruption that illness causes, but also to stop the disruption to all aspects of our society and life in BC. So let's dig in and don't do it.
Rob, do you have a follow-up?
I do. Switching tracks a little bit, as it relates to healthcare facilities and long-term care, obviously that's where the bulk of the obviously the cases have happened, and then obviously certainly the serious and deaths. My question to either one is, does the ministry have any idea how the virus is getting into these long-term and healthcare facilities, if not through the staff bringing it in? And is there any solution or solutions as far as remedying how how the virus is getting into healthcare and long-term senior housing accommodations?
Yeah, so we know this virus is transmitted through people, and we've known that from the very beginning. The main reason, the main way it is transmitted is through close contact with somebody who's infected with it. And we know from our work, but also from work around the world, that the single biggest risk factor for an outbreak in a care home is the level of spread and the level of virus circulating in the community. And we know that that's what we see here as well. So yes, it is staff, it is people who are back and forth within the long-term care home who unwittingly bring it in with them. And it is such a challenge. It has to do with all kinds of factors, whether people are minimizing their symptoms, not recognizing them, not being screened adequately in some cases, the challenges that we have with staffing, with access to PPE, with people using their PPE, the challenge with caring for people in long-term care, many of whom have dementia and other illnesses, where it's very challenging to maintain your PPE when you're helping people with personal things like bathing and feeding. So it is a combination of factors, and it is absolutely the most challenging thing that we've had to deal with in this pandemic, both here in BC and around the world.
And the issue of community transmission has changed through the pandemic, but since we took measures in the middle of March to limit visits, except for essential visits in that time, and then replace that with the policy in July, essentially the people coming in and out of long-term care are the staff. And so the source of transmission is that. We saw that in March and extensively reported on it then. You'll recall the movement of virus from people connected to travel to Washington State that showed up in our care homes was an indication of that. It's the reason for the single site order and all of the efforts on PPE and all of the other efforts on infection control. And we also have seen in more recent months the dramatic increase in transmission in long-term care linked to this season of the year, October, November, December, now January, where there's significantly more COVID-19 in communities, and that's been reflected in transmission into care homes. But it's a little different in acute care, where there's more movement of, obviously movement of patients in and out and so on, how outbreaks take place, or even in some acute care that has to do with rehabilitation, we've seen the same thing. But the primary source of it in long-term care is, of course, staff, and that's why such extraordinary efforts have been put in place, and why the pressure on staff, on PPE and on everything else is so high, and why it's so important that we do the work that we've done. I think in Fraser Health and Vancouver Coastal Health, talking about the immunization, that all of our care homes in those two health authorities now have received vaccine, and that's important because that's the primary source of transmission. But we see it everywhere in the province, and so that's why we've moved so quickly on that. I just want to say finally, because I think a lot of people out there are rightly concerned. It's been a long time since we've had any kind of regular visiting in long-term care. We have essential visitors, and we made changes a couple of weeks ago to clarify the rules around essential visitors. Since July, we've had other visitors, and one of the reasons why we're anxious for both doses to be provided to residents and to staff in long-term care is to try and work after that happens, which is will be 35 to 42 days from now, on what we can do to make life better in long-term care and allow more free, more visits and more social activity in long-term care than's been taking place, because COVID-19 is not the only issue in long-term care. We all know this, and we want to and are concerned about the quality of life of everybody.
Richard Zussman, Global News.
the issue you just raised there, Minister Dix, is the exact issue I'd like to ask on here. So let's start with one piece of that. You mentioned essential visitors. The senior advocate says that based on the approximations that the province has given, you're forecasting that only about 23% of long-term care residents will have an essential visitor that gets the vaccination. Why is that number so low? And can there be a policy to ensure that every person in long-term care has an essential visitor?
Yeah, so I think we need to understand the visitation that goes on in long-term care, and sadly, and this is data that the seniors representative has put out, it's only about 47% of people, residents in long-term care, have regular visits. And the essential visitors has been a challenging thing. It is, there is a process in place to try and make that easier for people. And the default, we believe, should be that every person, every resident who has a person who can care for them should have a designated essential visitor, but that has been a challenge to operationalize. But we are providing immunization to those essential visitors who have been designated. I don't have the exact number, but there's it was estimated by my colleagues in the health authorities from their work with care homes to be about 8,000 additional people to the 30,000 that are in care.
Just to speak to that, Richard, and I was partly working with the seniors advocate and others that we made the changes to visitor guidelines that we've made a number of times since the beginning of the pandemic. In May, we made some changes that particularly affected acute care and particularly affected people living with disabilities. And we made some changes to clarify the rules just recently. So I just want to be clear to everybody about the term essential visits is defined, and you can provide in the document which is available at the Ministry of Health websites the definition of an essential visit. But of course, everyone and every family and every person needs visits. And even though some are defined as essential and some are social, they're all important and they're all, in a certain sense, essential, just as we often get into the discussion with the term of essential with respect to workers or types of people working in society. And so one of our priorities right now in the first phase of our vaccination campaign effort is to provide, of course, to long-term care workers to protect long-term care residents to protect long-term care residents, essential visitors to protect long-term care residents. And once we've finished that, I think we'll have gone some significant way in making long-term care homes safer. It is beyond dispute that a broader view of visits than we've taken right now would have led to more infection in long-term care. That's just a fact, and it's the reason why these extraordinarily difficult decisions, some of the most decisions I've been most reluctant to be involved in, all of us are, have been made. It's to ensure to the maximum degree possible that we limit transmission of COVID-19 in long-term care because of its impact on people in long-term care. So I think it's fair to say some changes have been made. We're giving focus to those people who have defined essential visits. We also have a process for by which people can appeal if they don't agree with the decision about whether a visit is essential. And these are the changes we've made now, and we back that up with adding essential visitors to our immunization program. So all of that is a pretty strong response, and the whole purpose of which is to keep people safe in long-term care, but hopefully earlier than other changes we might make, also to allow more social activity for people in long-term care.
Richard, do you have a follow-up?
As we close in on everyone living in long-term care being vaccinated, when will those restrictions start being eased? I think Minister Dix just alluded potentially to having to wait that entire second dose period, which in some cases could be longer than 35 days as we sort of catch up to get to 100%. And once we get to that point, what will visitations look like? Is there a way that loved ones will be able to hold their loved ones in long-term care? How quickly do you believe something like that could happen?
Yeah, we're going to be following the data, looking at what's happening. We know that a number of outbreaks were underway as the immunization started, and it takes another 2 incubation periods before we get through that first phase of the outbreaks in some of the facilities. And then after the second dose, we know that maximal protection is about 7 days after dose 2. So that's what we're aiming for. We are going to be watching very carefully because we know that some people are still getting sick with COVID-19 even after being immunized because they were exposed before the vaccine effect could have that protective effect. So yes, we're looking at into the latter part of March. But we are making plans for how we can get people safely together as soon as we can in care homes.
This question is from Marcella Bernardo, News 1130.
Hi, thank you both for taking my questions. I wanted to ask Dr. Henry, because you touched on this a bit about the number of people who've been vaccinated already, but last week you gave us an update on how many people had allergic reactions. And I believe it was at 2, and now we're getting reports that some people have died in Norway after being vaccinated. So if you could elaborate just on what the situation is like in British Columbia as far as people having allergic reactions and whether or not there is any concern about people dying like we've seen in Norway.
Yeah, so I think Norway is a good example of something that's not unexpected when we're providing vaccination to people who are elderly and who are in long-term care. And we would expect to see that here in Canada as well, not from the vaccine, but just temporarily associated. We've not had any more reported allergic reactions that I'm aware of. What we have is a process for monitoring of adverse events following immunization, is what we call them, affectionately known as APHEs. So we do have a process where all adverse events are reported, and there's what we call a causality panel that reviews their reaction, reviews its association with the vaccine, whether it's before or after or when it arose, how the timing of it, whether it's severity. So there's definitions that we have, and we share all that information nationally as well, and Health Canada is putting out the information on the federal website. So those are things that we have had in place for other immunization programs and are stepping up for this program. As it gets more complicated, more products that are available over time and more people are immunized. It is one of those things that we do expect to see when we're immunizing large numbers of people, and we've started with the most vulnerable and the people with medical conditions. People are still going to have heart attacks. People are still going to die from their medical conditions, from cancer, from other things, and they're still going to have car crashes and other things that lead to death after immunization. So we need to monitor that very carefully and look at if there is any causal relationship with the immunization they just received. And this will become even more critical and important as we do more mass immunization in the end of March and heading into April.
Follow up, Marcella?
Just if you could further elaborate on the whole rapid testing thing in care homes, are you opposed to private care operators taking it upon themselves to use those rapid tests? If you could share them with them or let them have their own programs, because I understand some of them are already doing that.
I'm not opposed to anything that helps prevent transmission in care homes, of course not. And we do have some pilot projects. What the pilot projects have shown is what we thought all along. These are very resource intensive, and it's not the cost of the test. It's the time and the medical people that need to be there to monitor the tests and look at how they're being done and how they're being performed on site. So we know that it takes at least 3 people, that it's about 15 minutes per person per day, and you have to you can do multiple sets of them at a time, but they all have to be timed specifically, and you have to make sure you know which one belongs to whom. So it's not a simple thing to do, and it is something that they have been in the pilots been doing once a week. and even that was very challenging. And it cannot take the place of the medical screening questions that have to actively be done when you check in for work, and the screening that needs to be done on all residents twice a day. It cannot take the place of the importance of using all of the infection prevention and control measures that we know work within care homes. So it is a tool that takes a lot of energy and a lot of human resource time. And it is the opinion of most of my colleagues across the country and here in BC that the resources that we have that are scarce around supporting infection prevention and control in long-term care is most often better spent on other measures. But I certainly, if there are resources that private companies have that they want to use for that, it is one tool that can augment the other important measures that continue to need to take place in long-term care as well.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Susie De Silva, CBC.
Thank you very much. Just for an update on what the information you provided last week about the one case of the variant first found in South Africa. Just wondering if you have any more information about where this person might have caught it, if in fact there's another case at least out there that they would have caught it from, or where that may have come from.
The investigation is ongoing. These things take quite a bit of time. There's always a delay. The whole genome sequencing itself takes a bit of time. So this is a person who's was tested on December 23rd and is no longer infectious. But yes, we continue to try and understand where, and we continue to monitor, and I'll be giving an update. Because there's this time delay, we don't always have the whole story as we go. There's a number of about half a dozen other sequences that are being monitored right now that may be related to either the UK variant or the South African variant. So on Thursday I'll give an update on that. But no, we still do not have an understanding of where this person became affected, though there's a number of different places that we're now doing some additional testing on.
Follow-up, Susie?
Yes, please. And earlier we were talking, and you mentioned the strong recommendation, of course, not to travel, but we are looking at Family Day a month away at this point. Is there a chance that you're considering changing the recommendations against non-essential travel to making it public health orders banning it? And given the current set of restrictions are set to expire on the 5th, should people be making plans for Family Day? And if you could please answer in French as well.
Yeah, we're looking ahead at a whole bunch of things. There's, I'm told, Super Bowl Sunday, though it's never been a big thing for me. I'm more of a CFL fan. But there's that, there's Family Day, there's March break, there's Chinese New Year, which is coming up. Yes, many things that we're thinking about in terms of, a lot depends on what happens in the next few weeks. The extension of the measures that were put in place were designed for 2 incubation periods. So we need to look at what's happening, look at where we are with our immunization program, look at where we are with our daily case numbers and where we're seeing transmission events in our communities. And, right now, of course, it's very concerning in the interior and the north. So we'll be following that carefully and looking at what measures make sense. I have discussions with my colleagues on a regular basis about this, and we have a number of things that we'll be looking at coming up. Hopefully, if we start to continue on this trajectory of decreasing community transmission and increased protection in our care homes, we might have some ability to loosen some of the restrictions. But so much depends on everything that we do now, today.
Il n'y a aucune décision prise sur cette question. On a commencé avec ces mesures au mois de novembre et puis On a ajouté des semaines 2 fois maintenant, premièrement en décembre et puis en janvier, et c'est donc jusqu'au 5 février. Et tout dépend de la trajectoire de la pandémie d'ici et là. Mais ce qui est essentiel actuellement, c'est que les gens, en général, suivent des conseils et des règles et des lois de la santé publique. C'est essentiel actuellement. C'est un moment clé de la pandémie maintenant. Et donc, on va considérer, bien entendu, des changements. On considère ça chaque fois, mais c'est beaucoup trop tôt de considérer quoi que ce soit ou de planifier ce qu'on va faire la journée de famille ou autre événement que ce soit pendant les 2 mois à venir. Maintenant, il est essentiel de continuer sur le chemin sur lequel on est en voyage actuellement. Et je pense qu'il faut continuer maintenant. Et ça, c'est pour nous la chose essentielle. Et tout dépend sur ce que nous faisons. Et tout dépend de notre réponse actuellement et notre détermination de suivre à fond les conseils et les mesures de la santé publique. Merci beaucoup. Thank you very much.
Thank you.